Our theme is advanced diagnostics and therapeutics, and what we're looking at is the next level of delivering tailored, personalized therapies to complex populations.
So I think we still have far higher burdens of diseases like cancer, and obviously specific types of cancer. Despite all the advances in treatments, we still have high death rates in the UK from cardiovascular diseases. So even the traditional healthcare problems that we've been trying to tackle for many years remain far too burdensome. We have diseases such as dementia, for which there are almost no effective treatments. And we have an obesity epidemic that is very, very hard to manage. So we have a huge number of chronic health conditions that we fail to adequately address. And then we add into that our recent experiences with the COVID pandemic and issues around pandemic resilience. Antimicrobial resistance will be huge problems for us to tackle in the coming years.
And we're facing all this as members of a global community. The challenges of delivering equitable healthcare within the UK are one thing, but extending that beyond our borders is another challenge altogether that we're all part of.
So research within our theme will tackle these challenges by identifying, first of all, what the key questions are, and by being bold in our attempts to answer them. I think we are committed to trying to deliver research that is practice changing, that is meaningful to patients and to the communities that we serve. So our ambition is to be focused on research that genuinely will deliver change to people's lives.
The research that's likely to emerge from our theme is going to tackle this issue of matching the patient to the therapy. And that's a recurrent theme of modern medicine, where we're getting better and better at treating patient populations by identifying the relatively small groups of people who will benefit from a particular tailored therapy.
So in the college, we already have considerable strength in many clinical sciences, such as cancer sciences, cardiovascular disease, obesity, infection and immunity, to name but a few. And these are all underpinned by strength in public health, in health economic assessment. And our clinician scientists are lucky to work in very modern real estate. We have several new and modern hospitals within Glasgow and several national clinical services. So we have a lot of infrastructure that we need to move forward into the college futures.
Glasgow has a number of real advantages for the delivery of the stated themes. And I was attracted here as a clinical academic by several factors. There's a very large patient population, so there's an enormous amount of patient data. There's fantastic international level academic effort in multiple areas. And we've got a real edge in a number of really important research areas, including artificial intelligence and the handling of these very large data sets.
This is a time of tremendous opportunity. The advances in computational power, in artificial intelligence, our ability to genotype people en masse relatively cheaply, these need to be leveraged to deliver changes in healthcare and improve people's lives. And I think in many ways we're now limited not by what we can do, but by what we try to do. And our role in this theme is to encourage our community to be bolder, more ambitious, and to leverage these opportunities.
One vision, certainly, is to help the NHS to deliver really first-rate healthcare. So if we just think, for example, about the diagnostic part of advanced diagnostics and therapeutics, the diagnostic services within the NHS are under an enormous amount of pressure. And my clinical area as a diagnostic histopathologist is under particular pressure. If we can come up with advanced diagnostic tools which empower our consultants to get through their work more efficiently and more accurately, that has immediate benefits for the population and the NHS.
The College Futures Fellowships are very exciting. It's an opportunity for us to attract the best researchers to our institution and to give people the opportunity to be ambitious, to be bold, and to grow into world-leading researchers. The fellowship scheme will have an emphasis on particularly early career researchers, so bringing the best talent into Glasgow and giving them the opportunity to explore their ideas and to advance healthcare.